Back with you now on Listens Live. Today's show all about getting you healthy, getting you the body, the health, everything that you are after as we head into summer. Dr. Ryan Wermeling, certified plastic surgeon, joining us here on the set to talk about that. And you mentioned during the commercial break, we had some puns ready. We're having an uplifting conversation today. Tell us more.
So this is an exciting topic, and it's all about raising, the level of things.
We're 2 for 2.
Yeah, we're leaning hard into it today. So particularly talking about breast lifting. So over time, gravity and aging or something you just can't defeat. It's like taxes, it's coming for you no matter what. And so over time, gravity pulls things down, kids pull things down, breastfeeding, all of that just sort of makes things sort of settle down a little bit. And so what we can do is lift things up, get things back up into the position that they were before kids or before aging, or even after weight loss. Things just, that skin gets there and you decrease the amount of tissue that's inside of that skin envelope, and it just sort of settles down. The breasts sag a little bit, and so there are a lot of options to lift up that tissue and reposition, the breast to get a little more lifted appearance, and really, feel like you did, a long time ago.
Well, you mentioned this is an exciting conversation because unlike taxes, you have a fix. You have a way that you can help people if they're sitting at home and saying, this is exactly what I need. You have the option for them.
Right, absolutely. And so it is a very straightforward surgery to lift things up. Now, the important consideration is there are a lot of products that people will see online and things, some of those targeted Instagram ads that get you. There's no fix for breast sagging without surgery. And so, what we can offer, seeing a board-certified plastic surgeon, is that we have all of the surgical techniques to lift things up in a safe and reliable way to make things look nice and feel nice and have a quick recovery so that you can plan it out and get back to activity as quickly as possible without sort of spinning your wheels trying to seek out things that really aren't going to do the trick.
And you talked about some of that social media messaging. It can be confusing. They can put different terms in different places to make you think something. Can you talk about the difference specifically between a breast reduction and a breast lift? Because that may be one of those areas that there's some confusion, especially online.
Sure. So those two surgeries are very similar, and they share some of the same components. But it's almost like a spectrum of things. So a breast reduction is something that we do a lot of. People who have very large, heavy breasts, and sometimes insurance will actually cover reducing the size of that breast. We know that helps neck and back symptoms of that weight hanging down. And so a lot of my patients ask when they come in for a breast reduction, oh, do I get a lift as well? And so every breast reduction includes a breast lift because that just helps reshape that skin and lift things up. But not everybody needs volume removed from their breast, and some people don't want volume removed. You want to keep as much volume as you can. You just want it to sit upright, not have to sort of bundle it up when you put your bra on. And so just the lift surgery is important, that we can save all of the volume that is there already, but still lift things up and not lose anything that you've got.
I think one of the important things, Dr. Wermeling, to talk about is, and we've touched on this before, how technology changes throughout the years, and maybe your old way of thinking about these type of procedures is different than some of the techniques you're able to have now. So if I'm sitting at home, this isn't a new conversation for me. Maybe I already had old implants. I want to remove them. Can you talk about nowadays what we're able to do when it comes to maybe fixing things that weren't done right the first time or just need an uplift?
Right. So we do a lot of revision surgery in my office. I have a background in reconstruction, and so rebuilding a breast from nothing. And so I can apply a lot of those techniques to revising things that were either done maybe not the best way before, or just over time things change and your desires change. So particularly with women that have had implants put in many years ago, sometimes the breast sort of ages and falls down and the implant stays up sort of high and it's sort of firm. We can take out that implant completely, and so you can have a nice volume with no implant at all anymore. Lift up all of the skin, and if you need a little bit more volume there that the implant used to give you, but you don't want an implant, we can actually use your own fat, suck a little bit of fat with some liposuction from the little belly and love handles that everybody's got a little bit of, and re-inject that fat into that space where the implant was to sort of give you a nice rejuvenated shape with all of your own tissue.
To be here in Louisville, back in Kentucky, and able to offer this type of procedure to people and the help that you can give, what is that like for you personally when you're able to see somebody through start to finish and they come to you on the other side and say, this really made a difference in my life?
That's one of the most exciting things that I do, is seeing that immediacy of results. So people aren't waiting for a medicine to take effect over several months and slowly getting better. With surgery, we can see the results. I see it in the operating room and can know exactly what things are going to look like afterwards. And then, a couple of days later, when people are in my office, we're looking in the mirror and seeing those results right away and seeing how much of a difference that makes. And then, the fun part for me is guiding people through the recovery afterwards. So it's not like you get surgery, I see you once, and then you're left to the breeze. This is a relationship that we build, and I want my patients to know what happens every step of the way, because this isn't one thing. As much as we like immediate results, the healing process is an important part of the surgery. And so things are going to look different at day 5 than they are at week 5. And that's an exciting process for me to sort of see that develop and share that discovery with the patients.
Well, let's talk a bit about getting in touch with you, about how the process goes, the number you want folks to call, and if you want them to do some searching on your site first. Basically, the process, if anybody's sitting at home right now and they're going to your site here and they want to take part in this and maybe take the first step.
Right. So the first step is doing your research. I want people to come in. If people have a list of questions, that's great for me because it helps sort of guide the process and gives people a little bit of an idea to know about what to ask. But every time someone has a consultation, we go over everything. I've had some patients say that maybe I talk too much in the visit, but I'm happy to make that mistake rather than the other way around and not giving enough information.
Makes you feel comfortable too, being armed with all that information.
Right, exactly. And so, calling the office, the number is up on the screen there, or a really other good option is looking at my, Instagram profile. So that's just sort of a running, list of the procedures that we do and has lots of pictures on there and sort of the most up-to-date information.
Yeah, it's nice that there are multiple ways. Sometimes folks maybe want to do some digging behind the scenes, see things for themselves before they make that call, and Instagram sometimes can be a great place to do that.
Absolutely, and I probably should take it off my phone, but it's on my phone, so I respond to all my DMs. So if you have a question and you don't want to call or you get on Instagram, just shoot me a DM and I'll send you back some information.
Perfect. Dr. Wermeling, thanks for being with us again. You can find him on Instagram. You can call that number as well, 502-895-5466. And be sure to stick around because we have a familiar face who's going to be joining us here. Natalia Martinez will be representing Let's Dance Louisville. It's coming up next.